Hi, it's Dr. Noel Williams in Oklahoma City, Optimal Health Associates. We're going to talk about interstitial cystitis. Interstitial cystitis is when the inside of the bladder gets all inflamed. For many, many years, the thought process was it was autoimmune. It turns out it's not really autoimmune. It has a lot more to do with the biome of the bladder for the most part. As the probiotics or normal bacteria in the bladder change, you can get inflammation in the bladder, which causes irritation. Now, that does not mean that none of it's autoimmune, but the big predominant feature is irritation from abnormalities in the acidophilus or lactobacilli content in the bladder. And so that really changes approaches in many respects on how to treat it. It's about getting inflammation out and healing the bladder surface. So there's basically been one oral drug that's marginally effective and very hard to take, and now is like unbelievably expensive. So that doesn't, I think, is not really a good choice. So what we have to think about is more natural things. So we want to think about fish oil, we want to think about turmeric, we want to think about some medicines that can help with bladder spasm, like tricyclic antidepressants, again, not for depression, but help the bladder spasm, Myrbetriq, drugs that help that. Then we often think about using the Mona Lisa laser to help stimulate stem cell activation to decrease inflammation. We think about stem cell derivatives, a ton of this type of stuff. There's some things that urogynecologists do that occasionally are helpful, but they're never treating it. They're just trying to stop at least the spasm, and that's doing Botox injections in the bladder. That really doesn't treat anything other than paralyze the bladder wall a little bit so the spasm is better. So there's a role for that, but again, it's not really a treatment strategy. And so for treatment, you have to think about inflammation in the lining of the bladder, the bacteria content in the bladder, and so how do you get that better? So there's a lot of more integrative medical techniques for this than there are classic medical techniques. So always willing to help with interstitial cystitis. We have great expertise in it, have helped and solved it for hundreds and hundreds of patients over the years. So give us a call if you're having interstitial cystitis, or do more research on stem cell derivatives, ozone therapy, the Mona Lisa laser, and see if you can find a provider who can offer some of those solutions for you in your community. Take care. Thank you.